Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. I'm really pleased today. I've got a return guest I always like to talk to, and that is Timothy Bennett of the Drummond Group. Timothy is the Director of Strategic Healthcare Initiatives at Drummond, and he leads the development of new testing and certification programs to benefit really the national healthcare interoperability strategy. For over 20 years, the Drummond Group has been helping clients achieve interoperability, certification, compliance, and security. Timothy has an extensive background in internet and security standards for the exchange of documents and information. And Timothy, I recently found out you have a degree in nuclear engineering from Georgia Tech. Is that true?
I do, yeah. So,
I guess that's your fallback career, right? Nuclear engineering?
I guess so. I guess I can always go back and do it. It's been a while since I've chartered those waters, so to speak.
That's funny. Thanks for coming aboard again today, Timothy. Glad to have you.
Sure, I'm excited to be back again. Always great to talk to you, Jim.
One thing really want to start off with is I know Drummond has started a pediatric certification program for EHRs. What's the basis on that, and has that launched? What's the status for that pediatric certification?
Yeah, so we're in the middle of our pilot with 3 vendors right now. The vendors are Office Practicum, PCC, and NextGen. They all are our pilot participants, helping us sort of shake down this new pediatric certification program. We're planning on general launch of the program at the end of third quarter. We know that we'll be competing against all of the ONC deadlines are coming up at the end of the year, which I think you and I are going to talk about on this call as well. But this is more of a far-reaching sort of program that we're launching, as part of Drummond's sort of new strategy on making some specialty EHR practice certifications possible. Pediatrics is our first one. We've been working on it for about 2 years. Basically, when the Cures rule NPRM first came out, even before the final rule from ONC came out, we started working on this. The origin or the genesis of it really was back in the Congress's 21st Century Cures Act, where they called attention to the fact that attention to the fact that sort of pediatrics health IT kind of got left behind in the CMS incentive program Meaningful Use, because pediatrics really wasn't incentivized by Medicare and in many cases even Medicaid. So there's some lagging in health IT functionality in the pediatrics, and so Congress kind of called attention to that. In that act, they told ONC to work on pediatric certification, and ONC's response to that in the Cures final rule was to call attention to it, to call out, I think, about 10 different functional areas for pediatrics that EHR should implement, and basically set the stage for the fact. ONC decided that they weren't going to have their own certification program, but they certainly set the stage for that to happen in the industry. And ONC has also issued a few information briefs around pediatrics since the Cures update. But that was our reason for starting to think about offering this. But we looked at the 10 recommendations from ONC, and we knew the AHRQ Children's Health Format report that came out years ago, we knew that there was a lot more, specific pediatric functionality that was needed to be in the hands of, pediatric clinicians in order to improve child health outcomes. So we set about, basically building a more comprehensive pediatric certification program than what ONC sort of called out. So it includes their recommended 10, but we went back to the drawing board and with a panel of pediatric clinicians helping us and some other stakeholders, including EHR vendors, as part of that advisory panel. And so we spent the better part of a year and a half or more, sort of drawing up the what those pediatric recommendations and requirements would be for a pediatric EHR. That ended up all getting compiled into a new HL7 EHR pediatric child health functional profile that we also worked with HL7 to get balloted and published. And so you can look at that on the HL7.
Okay.
Part of there. So our test and sort program is built on top of that.
When do you think we're going? I know you're kind of in the early stages of this. When do you think we'll see the first live certifications rolled out?
Well, so we're certainly hopeful that this fall, after we launch the program, that at least our pilot program participants will be going through that. They're helping us shake down, but they their intention is to also be among the first to certify. But we'll be opening it up to registrations for any EHRs who want to get this Drummond certification for this pediatric functional functional requirements. So we're hoping to get some certifications done before the end of this year.
Oh, well, okay.
Now,
yeah.
One thing that I wasn't really clear about. So as part of the analysis here of what is pediatric functionality that's needed, we came up with a set of baseline requirements that everyone should meet, and then we also recognize that there's a lot of room for optional, advanced, more robust implementation. So in addition to the baseline, we have these optional badges or achievements, whatever you want to call them, advanced achievements, advanced support, pediatric support that EHRs can also show that they support. So it's sort of a two-tier type of certification of baseline, and then we recognize vendors who kind of go above and beyond and do some extra things.
Sure. I'm going to, something just popped in my mind. And so, right, there's been some nudging that EHRs needed to expand into the pediatric practice in a more focused way. And as new types of clinical and patient data is collected, moving forward, there's going to have to be new requirements for the ability of the EHRs to do something with that data. And so it may be years away, but I know the great promise of precision medicine involves genomics and the ability for EHRs to store and do something with genomic data. I don't know if you want to weigh in on that. To me, it seems like something that for the full implementation of that may be close to 10 years away, I'm guessing. You have any thoughts on that at all? Precision medicine,
about
genomics? Yeah.
Well, I mean, I think that kind of just sort of falls into this sort of category of sort of specialty practice or specialty EHR functionality. The thing that ONC is sort of, built out of the box since they started their program, it's really based on, some mostly general practice functions. And that's kind of been a little bit of a complaint, from some of the, specialty practices that, like pediatrics, like mental behavior health, which, by the way, I think Drummond is going to work on. That's going to be our next specialty certification program, probably, that we'll work on next year.
Okay.
but there's, I think as we sort of begin to expand in social determinants of health, genomics, clinical trials, and clinical research, cancer, all of these sort of specialty programs or specialty medicine. There's a need for specialization in the kinds of data that they collect, support, and we already kind of see that a little bit with the plans for USCDI.
Mm-hmm.
There's the notion, I don't know, of the USCDI plus plan where you can expand or extend the USCDI optionally to include specialty data, and I think that as time goes on, it's not just going to be about USCDI version 1, 2, 3, whatever, which has sort of the core data in it, but you're going to see these add-on, bolt-on data sets to USCDI for specialty,
Mm-hmm.
right?
Okay.
And so I know that there's a lot of work starting to be done on that, and so I think that those will kind of prove to be sort of the building blocks of how data is going to be exchanged, in the future between these specialty and maybe genomics kind of
Well,
plays into that.
that makes sense. That could be kind of a holding place for it. You mentioned the Cures Act, and so we've got some deadlines coming up later this year. If you would be so kind to wave whether a red or yellow flag at me and tell me what are the important deadlines between now and the end of this year, Timothy?
Well, this is the year finally when all EHR certified technology has to be updated to the Cures final rule. The changes that they made into the Cures final rule, with the exception of one criteria, which is the EHI, was it the B11 criteria? I think you have one more year for that one.
Okay. Yes. Mm-hmm.
But all of the being updated, having your CCDAs updated to USCDI version 1, and having your e-prescribing updated to the latest NCDP spec, which I think most people already are because of other CMS requirements in the past, deadlines in the past. But the big one, is having the FHIR APIs updated. FHIR APIs have been around since the beginning of the 2015 edition, and so EHRs have had to support APIs, but they've been able to roll their own, have proprietary versions of APIs supported, but now they have to move to the standardized FHIR R4 as part of their G10 criteria, which includes supporting Smart on FHIR, OAuth 2, Connect ID, and of course US Core 311, which is USCDI 1 version 1. So all that clinical data. So that's the big one. I think folks are moving towards this year.
And since that G10, that FHIR API, is part of the definition of a 2015 Cures Act base EHR, anybody who wants to maintain that has either got to have a third party that supplies that functionality or do it themselves. So it doesn't look like there's going to be any delays along that. I imagine y'all have already started doing quite a bit of testing for that G10.
Yeah, there has been some testing, although I will say, here at Drummond Group, we still feel like there's many EHRs that haven't tested yet. So I think it's going to be a busy second half of the year as folks start moving towards that deadline. Here at Drummond, we sort of anticipating this. We partnered with Aegis, which has a Touchstone FHIR developer, testing platform, and we've kind of co-opted it for also doing G10 certification testing. We took all of those test scripts and that platform through a rigorous ONC approval process. And last month, ONC approved Drummond Group's alternative test method. So now we offer our customers the ability to either test and certify G10 on the Inferno test tool, or they have the option of coming on to the Touchstone platform to do their testing and certification as well. And we feel like that platform has a lot of value add to those EHR and health IT products that are going to build their own, like you mentioned before.
Sure.
So if you're building your own, you need a lot of, you need some extra help, to make sure that you're, developing and implementing. You're going to be able to pass the tests. So we have those two options now for, that we're offering.
I'm sure it's going to be busy next, we're almost in August, so the rest of the year. For our listeners who have just joined us, this is Jim Tate, and you're listening to the Tate Chronicles. My guest today is Timothy Bennett of the Drummond Group. Timothy, I'd like to hear your thoughts, maybe a little more generally on interoperability in terms of other potential rulemaking from ONC and CMS. The plans on the horizon to really advance interoperability. What do you see out there?
Yeah, I think there's a couple of fronts, Jim. I think, there's a big spotlight now on equitable healthcare, social determinants of health, and how that's going to end up getting incorporated into, future rulemaking. I think that kind of gets back to a little bit about, the data sets and things like that. So I certainly will anticipate some rulemaking, probably from both CMS and ONC around, things targeted toward equitable care. CMS has a whole office dedicated to that now, and I know ONC is very involved with that as well. So I think we'll see some work coming down the pike, so that health IT can help support a more equitable healthcare in the at the hands of the providers and the clinicians, so that citizens of all socioeconomic can get the healthcare and the positive healthcare outcomes that they need. So I think that's going to be a big focus. The other one is just fire, and more fire. Jim, it's there's all these use cases that are just with the advent of fire now, and with the first sort of tier of rulemaking around fire from both CMS and ONC has been with patient access, using fire APIs, presumably with a marketplace of smart apps and web apps and things like that, so that patients have access to their clinical data, their EOB data, and just being able to access and do provider directory lookups, or the big vision too is to be able to do some medication shopping, to find out
sure
which pharmacy in your area has the best prices on meds that you have prescriptions for. So that's been the big focus so far now, is just opening up data to patients and encouraging patients to be more involved in their own healthcare. But I think the next round of fire use cases are going to be more of the interoperability state. I know CMS is looking to move quality measures to fire-based reporting. There's, from both CMS and ONC, there's been a lot of RFIs and proposed rules around essentially revamping the prior authorization processes between providers and payers, and then even just how providers and payers communicate with each other, exchange data with each other. So, there's fire use cases for all of that. That is in various, states of maturity or development now. But I suspect, here in the next couple of years, we're going to see, that next round of fire use cases that are going to affect both payer systems and provider systems, EHRs. You're going to see fire being the essential communication protocol, between those two parties, and that's going to affect both EHRs and payer solutions both.
Timothy, that's one of the things I'm really fascinated to see. Once these fire APIs are up and running, what the traffic's going to look like. Will it gradually increase? Will it be like one of those hockey stick things? We're just going to have to wait and see how quickly all that takes off.
Well,
yeah, go ahead.
Yeah, well, good thing, and there's some big brains that's been working on that. ONC had a few years back instituted what's called the fire fire. It's called FAST. It's the Fire Task Force. Basically, to begin to develop a lot of the sort of infrastructure underpinnings for doing fire at scale. It's the Fire Scale Task Force. That's what I meant to say. So how are you going to do all these fire transactions at scale? And so that provides directory lookup services, identity services, security, services that just sort of a lot of the sort of underlying things that everything needs to be built on to in order to do millions of transactions. These fire transactions, which will be required when you start getting into, prior authorization and, other payer data exchange, payer to provider data exchange, that sort of thing. You're going to have a fire infrastructure that you're going to have to build on to. So that was ONC task force that sort of got it off the ground, and now it's been recently switched over to an HL7 accelerator. So, that's what's going to drive, being able to, the future of being able to do these fire transactions like this.
And we just we know the obvious use cases. There's we don't know what we don't know. Once this is becomes active and easily available, those third party startups that come into being, whether it's for personal health or what it's hard to imagine. Once the foundation is there, people start thinking, well, maybe I can use this Fire API for patient benefits. We just don't know. It's going to be fascinating to watch that.
It is going to be fascinating to watch. Yeah. I think the marketplace is really going to blow up around fire over the next few years.
And that's one thing that has kind of been a knock on healthcare technology, was that we didn't see those that entrepreneurial spirit for various reasons, and now this looks like that's going to open the door to that. Timothy, before we totally run out of time here, how can our listeners find out more about the Drummond Group? How can they reach out for more information and see what you're doing and connect with folks at the Drummond Group?
Yeah, for just general things, info at drummondgroup.com is a good place to, to start your query. If you're interested in, what Drummond is doing to help developers with, getting certified to fire APIs and whatnot, fire, that's FHIR, fire at drummondgroup.com is a good place to start. Or, you can just reach out to me directly, Timothy at drummondgroup.com. Pretty easy there. So,
well, great. And
then, of course, just our website at drummondgroup.com you can navigate to all the different services that we offer.
Okay, well,
and get more information.
Thank you for that. To our audience, thanks for joining today on this episode of the Tate Chronicles. I offer a special salute to my guests today, Timothy Bennett of the Drummond Group. Timothy, thanks for coming aboard today.
Yeah, as always, Jim, it's my pleasure. And it's always great to sit down and have a talk. Time always seems to go so fast.
It does, and I appreciate your willingness to jump on and kind of keep us up to date. You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.